chanson d'amour, la mer a bercé mon cœur pour la vie. Bercé le long des golfes clairs et d'une chanson d'amour, la mer a bercé mon cœur pour la vie.
Second leg, once the green line's green, it's live.
Good morning. Well, it is such a pleasure to welcome you all back. It's a beautiful Saturday morning, and we've got some work to do, but then we're going to go give ourselves some joy this afternoon. I have to say I was so heartened. We're getting a lot of really good comments, about how this has been so meaningful to many of you. And, the Planning Committee did what it could do until Friday morning, and then it was up to all of you. So I think you've done a phenomenal job. One of the things that heartened me most was talking with one of the tables who, sat down with people they didn't know, and, first a few of them said, well, I'm not sure I would have chosen to sit at a different table, but this morning they were all beelining for each other, leaving their friends behind to get to their new best friends. So that, to me, is exactly what we had in mind. So beeline to your new best friends today. Just a couple of announcements and then a little bit about the morning. There's no need to sign up or register for today. If you are, to get your CEUs, you've got to bring your evaluation at the end of this morning to get your certificate. So if you have any questions, of course, Fabiana or any of us who are in the red lanyards, and of course I don't have mine on, but feel free to contact any of us with the red lanyards if you have questions about any of this. We're going to start this morning with Dr. Jane Barnsteiner again coming back to let us know how we as a community have scored on the value sort, and then ask you to think a couple of questions about that. And then we are very privileged to have Rian Eisler here, who will be helping us move to this really important next step, which is we're learning more about ourselves, but then how do we go back and create partnerships and environments where this really is going to make a difference. All along, we never intended this to be just all about self. There is no I in joy. But there has to be some to start with. But she'll help us. We'll have some exercises that Dr. Teddy Potter will help us move through. And then the final reflection will be some things to take it on the road. And that won't be very long. And then we'll bring a close. And then we'll be on our way to carry back to our home institutions what we have learned, experienced these 2 days. So with those comments, I will welcome Dr. Jane Barnsteiner back to the podium.
Thank you, Joanne. Is the mic working okay? Great. Well, thank you all for showing up on this fantastic Saturday morning. Hopefully some of you enjoyed the beautiful sunrise and the full moon, or what seemed like a full moon last night. It was quite glorious. And great information to share with you this morning, and hopefully have some good conversation around understanding our own values and how they contribute to our joy in work, and then understanding the folks that we work with. First of all, let me just say that my slides will be on the website that Fabiana is going to be setting up, that will have the PowerPoints from yesterday, the Joy in Work inventory, and these slides. So you'll all have that available to you. And thank you to the 59 people who completed the Joy in Work inventory on a computer yesterday. So we ended up having a total of 106 of you who submitted a Joy in Work inventory. So thanks for those who brought theirs along yesterday, and then those who completed them online. And I had the privilege of getting up very early this morning. I'm a morning person, so 7:30, I'm done in the evening. So got up well before the crack of dawn and put everything together. So for those of you who have a copy of what you submitted, terrific, pull it out, and you may want to use it as we go along. I know that many of you will not have a copy of your inventory because you did it electronically yesterday, and so you don't have a printout of it, or you may have forgotten to bring it, and that's fine. You're not going to need it. Maybe when you go home, you might want to pull it out or take it again and print it off, and then compare and contrast with what we have. So to kind of put things in perspective here, regardless of what field you're in, public health, vet medicine, nursing, what we all do is really important work. The work we do is hard. Our patients' lives depend on us, whether it's communities and clean water, whether it's we're taking care of horses, we're taking care of the meat supply, if we're working in communities with AIDS patients or taking care of critical care patients. All the professions that we're involved in, lives depend on us. And there are no perfect systems. So we all work in systems and structures that at times work really smoothly, but a good part of the time have some imperfections that will impact the way we work. We also work with people who have values that are similar and oftentimes different. And you'll see this when I tell you about the value sort. But what we want to focus on this morning is our responsibility for our own personal, professional joy and how we can increase our own self-awareness and our own professional joy. And we can do that by knowing, like yesterday, what kind of joy we were getting in our work settings. We know it by increasing awareness about what our own values are, and if we're being true to those values, particularly in the various work settings where we are. Being aware of joy at work. And in many of our professions, and I could speak most for nursing because that's what I'm particularly most familiar with, we often focus on what's wrong and all the problems that we're experiencing. And we can flip that and need to much more often to focus on what's going well. What has brought me joy today in terms of the work that I did, the colleagues with whom I'm working, the fabulous organizations that we have the opportunity to work in. And then lastly, increasing our knowledge and skill at accepting that we work with people who have similar and different values. And that is another component of diversity. In accepting, my values are not right and true, that we all have different things that we're looking for, particularly in our professions. So with that as a perspective, let's talk about, just a reminder, this was the definition I shared with you yesterday about professional joy. 2 components, control over our inner life in terms of investing our energy in having realistic goals and a skill match with the opportunities, particularly skill match in our work. And recognizing that we're all in fantastic professions and have the opportunity to be doing fulfilling work that is really making a tremendous contribution to society. So what values are important to me in relation to professional joy? Well, I love this value sort exercise, and many of you came up and talked with me yesterday and again this morning on how it caused you to think. Some of you shared that you had family members take it, and it's a great conversation starter. But these are 30 values that this group at Harvard has honed down over the years and been using nationally and internationally in terms of teaching values clarification in many, many, many different settings. So 106 of you turned in your value sort. And these were the top values that you identified. 80 folks said that honesty and integrity were your most important, or were in that list of important. Rewarding and supportive relationships were in the most important category. Creating balance in your lives, 50 out of 106 folks said that this was in their most important category. Faith, understanding and helping others. And then a focus, a value on quality. And then in the values that as a group you scored lowest, 86 of you said out of 106 that fame and success were in the least important category. Wealth and material well-being, which is great because we're all in professions where we're not going to, make the big money like the Wall Streeters. Having power and influence was 52 out of 106 of you. Having professional recognition, 48 of you said that this was least important. Having broad interest as a value, faith, and spirituality. Now, if you'll recall a comment that I made a few moments ago around people having similar and different values, you will see that, faith is on both ends. So for some people, faith is in the most important category. And for another whole group of people, faith is in the least important category. So it's important that we recognize that there's similarities and differences within our work groups. And so it doesn't make things right or wrong, and it doesn't mean we can't work together. We just need to understand each other. So, okay, Jane, so that's how we all fit. How do other health professionals rate things? Now, this is a group of academics, physicians, nurses, healthcare administrators who are all in academia. And their top values are honesty and integrity, rewarding and supportive relationships, creativity and pioneering, being in positions where they can be creative, forging new paths, having vision to work with, and personal growth and learning. So the similarities that you share, the 106 people who responded, honesty and integrity, rewarding and supportive relationships were on your group list, as well as this group of healthcare professionals. The creativity, vision, personal growth, and learning were not top values for this group, but rather faith, understanding and helping, and quality. So a little different there. However, the values that are least important are identical to the other group of health professionals. So interesting. So what does this say then? How does this group compare with everyone who's done this value sort on the Harvard website, which is thousands and thousands? Well, on the Harvard website, and for those of you who printed out, you were able to see how your own personal response was to all of the respondents on this website. Honesty and integrity, rewarding and supportive relationships, personal growth and learning, creating balance in one's life were top values. And the lowest, fame, success, power and influence, wealth and material well-being, and recognition from one's field. Every one of the lowest, again, fit with the lowest, your least important values. In terms of the top values, this group matches the total Harvard group: honesty and integrity, rewarding and supportive relationships, and creating balance. So you share that as a top value with everyone who's responded to this value sort on the website. However, you identified as a top value. You did not identify personal growth and learning as a top value where the Harvard group did. So interesting that all three groups have the same least important values, but some different things that are top values. And so again, what that tells us in our workplace, people are coming to work for valuing different things. And so we need to understand each other, and we need to see if we can get a match with the work that we're doing and the positions that we have with the values that we have. So I'd like to take just a couple minutes and have you have some conversation at your tables, knowing that this has been quick, but particularly not so much, I don't know that you can spend a lot of time because people don't have their value sort in front of them, all of you. But what was enjoyable? Have a conversation at your table. What did you find was enjoyable or discomforting about doing this value sort exercise? Many of you did talk with me about some of the discomfort that you did have. What did you learn from doing the value sort? And do you think there's any benefit to doing exercises like this in terms of this topic of professional joy? So I'd like you to take about 10 minutes and think about these questions, and then we'll go back to what we can do to increase some of the exercises we can do to increase our professional joy. So what was enjoyable about doing the value sort? What was discomforting? And then, was it helpful in terms of influencing your perception of professional joy?